mortality, morbidity, outcome becomes very important in burns. So there can be a lot of applications of AI in burns. Okay, and data is doubling every single minute. And analysis of this raw data, this big data, is very difficult by conventional statistical models. So we need to have input of machines in this. So that is the background. No, there is a problem. Let me do it from here. प्रॉब्लम उन्होंने ओपन गलत कर दिया था. सो बैकग्राउंड ये चल नहीं रहा आपका, नहीं उधर नहीं चले एनी हाउ. सो वी विल बी, नहीं ये डिस्प्ले नहीं हो रहा वहां पे इसका. सो इसको जरा सेट कर लीजिएगा बैकग्राउंड. देन वी विल बी मूविंग टूवर्ड्स व्हाट आर द बेसिक्स ऑफ दिस आर्टिफिशियल इंटेलिजेंस. So there are four basic models of artificial intelligence. One is machine learning, the second is computer vision, and the third is natural language processing. So we will be talking about what are the basics of these three concepts and which one is the advanced, and then what is the combination. Thank you. There is a problem. Yes, चल नहीं रहा. नहीं एक ही है, वो डिस्प्ले नहीं हो रहा, यहां से वहां डिस्प्ले नहीं जा रहा आपका. चले मैं वैसे सुना देता हूँ. लेट मी, आई कैन टॉक विदाउट दिस बेसिक्स. यस यस श्योर. हम भी नहीं श्योर हैं. सो बेसिक कॉन्सेप्ट्स की भी बात करेंगे फिर हम. देन वी विल बी मूविंग टूवर्ड्स एडवांस्ड मशीन लर्निंग एल्गोरिथम्स, देन कंप्यूटर विजन, natural language processing, and the current and future applications of AI and limitations of AI. So background I have already talked about. Now there are basically artificial intelligence is about cognitive functions, problem solving, by which they can recognize the words, the objects. So that becomes very important in burns, recognizing the objects and words. And based on this, then there will be a decision making. So basically two components of artificial intelligence. One is physical interaction with the environment and the second one is virtual one. Physical interaction is what robotic surgery is, what the augmented reality is. But virtual is where we use the mathematical models. Where we use about the mathematical models, machine learning, artificial neural networks, and deep learning. So we will be talking about this component. So I'll be explaining these terms and how they can be applied. So the virtual domain refers to machine learning, neural networks, that is deep learning, natural language processing, and computer vision, which I have talked about. So I'll be discussing the details. So these are four main terms which you will read in any article related to artificial intelligence. So try to comprehend these terms so that when you are reading the article, you can know what they are talking about. So what is machine learning? So this is the all about artificial intelligence from basics to advanced. Machine learning, basically there are four keywords. You see there is prediction, there is structured data, mathematical and statistical models. So what is important is that it makes a prediction based on a structured data using statistical and mathematical models. So if we say that artificial intelligence can be done without statistics, no, it's not possible. Basically, this is an advanced statistical modeling. Now it has three main components. One is supervised learning, one is unsupervised learning, and last is reinforcement learning. This is, we are talking about machine learning. So with reference to burns, what is supervised learning? You see, we enter the data, we label the data: superficial burn, superficial partial thickness burn, deep partial thickness burn, full thickness burn. And then we ask the machine to make a predictive model where machine can predict whether it is a superficial burn. Now here the important thing is data is being entered by the expert. The classification which he has said given to the computer, that would be interpreted. So again, it is dependent on humans. Asif Beg Mirza Sahib recently died. He was my teacher in final year. He used to say, thank God computer has not replaced the man behind the computer. So here everything is being done by the man, because he is entering this data, he is labeling superficial burn and rest of the burn. So computer will be predicting that model. So that is supervised learning. Next is unsupervised learning, where you just enter the pictures and computer gives you a pattern. He would say these pictures are similar, these are similar, these are similar, and then you can see to which group it belongs to. That is unsupervised learning. And last is reinforcement learning, where the model makes a prediction, then you tell the model that your prediction is wrong, and then it learns, because if these two are superficial burns, one is predicted rightly as superficial burn, the other has been predicted wrongly. So feedback would go to the machine and it would rectify it. So there are three types basically, and this can be easily used in prediction of the burn models. Next is advanced machine learning. What is it? We will be talking about this. Now this is an important concept. Now you have to differentiate superficial burn from a deep burn. So here there would be a line. Simply what we can do, we can classify the burns on one characteristics, on 2, 3, 4, 5, 6. But imagine if you enter the biopsy report, the type of the burn, color, pictures, everything you can enter, and then they would try to differentiate between the two. So it is basically called support vector machines. Now in an article, if you read about, they have used support vector machines, meaning thereby they have entered a lot of data and then they have separated it into two categories based on that data. Why this is called support vector machine? Because these are important. These are support vectors. These are the ones which are closest to the line of demarcation. So here these support vectors would be used for differentiating the problem. Now you can see it in a video.
Some of the simplest and arguably most elegant methods of classification. Each object not classified is represented as a point in a table-dimensional space, and the coordinates of this point are usually coefficients. SVMs perform classification tests for a Jordan island, that is already 2D or maybe 3D, in such a way that all points of one category are outside of the hyperplane, and all points of the other category are on the other side. And while there could be multiple such hyperplanes, SVM tries to find the one that best separates the two categories, in the sense that it maximizes the distance to points in either category. This distance is called the margin, and the points that fall exactly on the margin are called the supporting vectors. To find this hyperplane, in the first place, SVM requires a training set for a set of points that are already labeled in the correct category. This is why SVM is actually a supervised algorithm. In the background, SVM solves a complex optimization problem that maximizes this margin and already has strengths, so that points of each category should be on the correct side of the hyperplane. Practice, you don't worry about the details of this optimization.
So again, basically support vector machine is a supervised learning where you enter the data, the machine analyzes lot of data, lot of parameters, lot of variables about, for example, burns. They would see the age, the mechanism of burn, the biopsy report, the photograph, laser Doppler imaging. So all the data about a burn wound, if you enter into the machine, they will analyze it and then they would try to predict whether it is a superficial burn or a deep burn. Okay, now this is another advanced form. You can read this term in an article, artificial and convolutional neural networks. One is support vector machine, second one is this. What is this? This is a little bit advanced form. What is being done here? We have entered a data. Then there are two hidden layers output is after those hidden layers. The more these hidden layers are, the better would be the output. Meaning thereby that you have entered the data, then the computer analyzes it analyzes the data at its level. This is basically analogous to what is happening in our brains. There are multiple synapses. So we are getting data from various sources. The capacity of human brain cannot be matched with this analysis, because we are not using our capacity to its maximum. So this is the advantage of artificial intelligence over our brain, our human brain. The principle is same. So we are getting the output after multiple layers. So this is basically deep learning. One was support vector machine, now we have moved towards deep learning. Which one would be better? Deep machine learning. So, but obviously it would have more cost, it would have more intricacies, and obviously it would be difficult to develop. Next is computer vision. This is again most important for burns. Not only for burns, I was reading recently an article published this month where they have entered the faces of different patients into a software, and then they have tried to predict a model based on which the software can predict the age of the patient. And then what they have done, after they have validated that model, they have entered the patients, pictures of the patients pre-operatively of aging patients and post-operatively, and have tried to identify which facial feature decreases the age maximum, periorbital, face. So this is being used. So when I was reading that article, I was quite clear about the terms, though they have used that computer vision and deep convolutional modeling. So I would be knowing what they have actually done. So computer vision becomes very important in burns also, because what it does is that it visualizes the picture with a different angle. It reduces the background noise, it focuses only the area of interest. So just imagine looking with a human eye and looking with a computer vision. So there would be a difference in that. It causes image segmentation, it divides the image into areas of specific interest. So for example, this is a different option. There is a thermal imaging, there is laser Doppler imaging, and there is clinical photograph. So if you enter all three into, the computer would look at the areas of interest and would try to convert all these three into a one common figure based on other data, and then it would be able to predict the thickness of the burns. We will be discussing this in detail in the end. Last but not the least, now the first one was support vector model, second was deep learning, third was computer vision, last is natural language processing, which is being used by chat. So they are using just this natural language processing. So the important thing is that you have to understand not only the meaning of the language, but actually the contextual meaning of the language. So lot of data is being entered, and then computer replies to you like a human being. So that would have lot of applications in burns we will be seeing. So this is the basics. Now current and future applications. This is an article published. You can see the maximum articles are on assessment of burn depth 26. There are quite few on other areas also, but these are the total number of articles, which are not too much, very less. So there is a lot of area of research available in artificial intelligence. So one is prevention. We can identify patients based on occupation, social factors, substance abuse, and other risk factors, and we can specifically target those populations. If we enter all the data of burn patients along with their these information, we can identify the high risk areas and we can focus our prevention. Most important is virtual and augmented reality in burn prevention. We were working on a burn prevention model. We teach the patients, we show them the videos, but if you show a person where the person is part of that incident happening, meaning thereby augmented reality, they would feel part of something being thrown on their body. They imagine themselves having fire. So that would actually lead them to the better prevention, because they would actually feel that environment. So that is most important. If we have to work on any future preventive strategy, we need to work on augmented reality. Burn depth classification, I have already talked about. Now you just see digital photography, infrared imaging, laser Doppler imaging, optical reflectance, and thermography. You enter the data and then AI would tell you what is the depth of the burn. Again, the biggest problem is to differentiate between superficial partial thickness and deep partial thickness. As it is for the humans, also it is for the computers, because that is the most difficult thing. But still, softwares have been developed. Healing time you can predict based on this. Then this is most important, accurate estimate of the burn depth assessment, where they have developed a model in which surface standardized body is there. Then you match with the standardized body the actually the body of the victim, and then you superimpose, and they can give you an accurate assessment of this total body surface area burn. The important thing is that it can give you within seconds, and it would be objective. It won't be dependent on operators. It may not be exactly 100% right, that is the limitation, but it would at least help you in estimating it quickly. Then this is most important again. When we are resuscitating a patient of burns, the urine output falls, we increase the fluid intake. Then urine output increases, we decrease the urine this fluid intake. You can see here the urine output has increased, we have decreased the fluid intake. Now the urine output has fallen down, we have again increased the input. So this is this has to be done manually. If we can enter the data of lot of patients like this, the computer, the program would tell us how much fluid to be increased for how many times, so that these fluctuations are minimized. Again, a very important concept where we have to tangentially excise the burn wound. It becomes very difficult, particularly if we are doing it under tourniquet control. It becomes very difficult to assess the viability, whether we have removed the viable tissue or not. The traditional methods have been to see the pale fat and this pinkish, but again it becomes difficult for even the experienced surgeons. We can enter all this data and it can help us in determining. Next is, this is predicting survival in burn patients. This is our contribution to this artificial intelligence, where we have developed a model and we have predicted the injury, the survival pattern. This is again can be used in burns. No, this is an important component for medical educationists. The decision, the decision is taken based on an algorithm, and if that decision turns out to be wrong, who will be responsible? The developer, the person using, or the person who has taught that? So these are some ethical issues or limitations against artificial intelligence model. So be careful whenever you are using an artificial intelligence model, that you have to take the responsibility will be on yourself, not on the developer of that program. Limitations. The first limitation is quality of data. If quality of data is not right, artificial intelligence would not work. Secondly, who is entering the data? It is a human bias that we try to enter the interesting cases, we try to enter the cases based on our personal biases. So again, that would not help us. And lastly, the most important thing is, we don't know that whatever we are entering, is it representing the normal population or not. So at the end of the day, it is all about the quality of data, quantity of data, and how it has been entered, because it's all about data. So what is happening in the market? So I was just searching. This is a press release published on January 11, 2024. This is Spectral AI's enrollment in pivotal study to validate deep UI for burn injuries. What they have done is, they have developed their own data bank, where they have collected pictures of the burn patients, validated pictures with validated data, clinical data, and most importantly biopsy report, because the gold standard still is the biopsy to determine the depth of the burn wound. Now, I think this would be a major change in future, where all this data could be utilized to predict the depth of the burn wounds. Okay, so this is the applications. You can see prevention, community-based assessment, emergency management, then perioperative management, and then post-operative recovery and rehabilitation. So all these aspects can be utilized in burns, the application of AI in burns. So that's all, and let's shake hand with the artificial intelligence, with this caveat in mind that the computer has not replaced the man behind the computer. Thank you very much.